rectal vaginal fistula. See that? See how that's happened? Or even worse if it's urethral, vaginal, and then vaginal to rectal.
And you're born with that, or that?
It happens. Sometimes it happens. They could have developed cancer. My aunt, she passed away last month. She had this. She had rectal cancer. She had this situation. And what happens is what? You can imagine the potentiality for infection. Fecal matter can travel into the urethra. You see these things that happen. Really not, it's really very devastating. You can imagine how that is. Talked a little bit about chronic wounds. Again, I talked about it simplistic, the repair process. Wounds that don't heal within 2 to 4 weeks considered chronic. It's abnormal, but it's usually tied to that patient's chronic health state. Pressure ulcers. We talked about it. We saw pictures but I wanted to talk about the significance, and y'all recognize bony prominences. Look at that. The inner cord, I don't think I'm able to do this, but you guys, this part here, right here on the inner aspect of the ankle. Either side, really. You see how those bony prominences can quickly result in breakdown. Look at this right here.
Is that an ear?
That's an ear. That is an ear. And it's where this person has been in bed, and we have not been careful with our consideration. This is very flimsy collagen type material. Person that's frail and they already have compromised skin, and it can easily break down. I told my students, no, it's adult health 1 students. Remember what I'm doing here. And you guys will come into adult health 1. You haven't yet had a chance to insert a Salem sump, or maybe you have. I can't remember. No. But right here, it's an NG tube. It's nasal Salem sump that travels down to the stomach, right from the nose down to the stomach. You've used this for decompressing of stomach. Maybe they are vomiting, and you need to sump out their stomach. But what happens with frail and elderly patients, this part right here, we fail to recognize this is such a sensitive area of skin and tissue. We put that tape right here tightly, we secure it, and we have that tube taped up like that. This part right here, you must be very cautious and assess that skin, because you can cause tissue damage, and it becomes a permanent damage, because once it's necrotic, and what happens is when it does finally, you have the tube out and it finally does heal, you have a little bit of a dip there. You have essentially damaged the person's facial appearance because we weren't careful. Also, importance of checking the oral mucosa. When you have things that are not normally in a person's body, such as what they call endotracheal tubes, y'all will learn that later on. These plastic hard tubes that are inside the mouth that go to the lungs to help someone breathe. And then we don't go in and we assess and do follow up with mouth care, good oral hygiene, and assess the oral mucosa. You can have such damage to the tongue and to the